The high incidence disability that I studied was stuttering, which falls into the category of a speech disorder. By definition, stuttering is a communication disorder that interferes with a person's ability to speak fluently. It's also known as stammering. So, a person with a stuttering disorder may have involuntary syllable repetition, or their syllables may be elongated when they're trying to speak, or they can have interruptions or blocks in the smooth flow of their speech. So this type of disorder again falls under the speech category. Our speech is the system that we use to produce sounds, and that is the basis of our language. So depending on what language you speak, you are going to produce certain sounds. Well, someone that has a stuttering disorder, they're going to have interruptions in that rhythm of speech. It is also known as a fluency disorder. So what causes stuttering? It's actually unknown what the exact cause is. It is a multifactorial disorder, which means there are several causes for this particular disorder. So, some possible causes could be early emotional trauma. If a child experienced something that was emotionally disturbing, they may experience some stuttering beyond that. It can also come from parenting behavior, depending on how the parent maybe disciplines the child or speaks to the child, that could incite some stuttering. It can also come from other interactions between your motor, linguistic, and emotional factors that bring about stuttering. Now, as far as your brain is concerned, it is the Broca's area of the brain that is a big component in the neural network for speech production. So, when we have a low blood flow to that area, then we're going to have an issue with producing our speech. We also can experience low blood flow to the superior frontal gyrus as well. And what it does is it disrupts our motor planning, our phonological and syntactic processing, and lexical retrieval. So it makes it very difficult for us to get our words out. And a person with this low blood flow will experience stuttering. So the lower the flow of blood in that area, then usually the more severe their stuttering is going to be. Now, the incidence for this particular disorder is about 5% of the population. That means about 1 in 20 people will experience stuttering at some point. Generally, stuttering is going to appear between the ages of 2 and 6. Usually, it's after a person is able to formulate full sentences that you will begin to notice if they have a stuttering disorder. The prevalence is about 1% of the population, and it is more prevalent in males than it is females. It's about a 4-to-1 ratio. So that means for every 4 males, 1 female will experience stuttering at some point in their lives. Now, what's promising is that about 80% will outgrow the disorder. So if a child starts stuttering at 2, by the time they are 7 or 8, they may have outgrown the disorder and no longer have a stuttering disorder. However, it does take early intervention. The sooner you start to work with children, the better and the faster they will outgrow this particular disorder. Now, IDEA is set up to ensure that all students have access to education. And so, because students with stuttering have a speech impairment, they qualify for special education services. About 16.3% of students between the age of 5 and 21, which is about 1.6% of our school age population, are served with special education services. So these students either will work individually or in a group with some sort of specialist in brief sessions several times a week to work on their stuttering disorder. Now, there are some barriers to successful implementation. First and foremost, lack of parental involvement. Sometimes it's hard to get parents to accept the fact that their child has a disorder and to get them the help that they need. We also have language and cultural barriers. If you have someone who does not speak English, it's very difficult to explain to them what needs to happen concerning their child. Or if the child doesn't speak English, it's hard to treat their stuttering disorder. You can also have individual differences that occur among school staff. They may not agree on the treatment plan, which makes it difficult to implement it for students. And then we also have lack of resources. A lot of times your speech therapists are spread amongst more than one school, and so they have limited time. Of course, we have limited staff, and then sometimes there's an inequality in advocacy. Some students will receive services, whereas other students may not readily receive the services they need. Also, it's been found that a lot of these speech therapists need more training in the area of stuttering because it's not something that is highly focused on in their educational career. Now, the diagnosis, typically you're going to be your caregivers that are going to be the first ones to identify this problem. School teachers may also identify it and they can recommend the child go for speech and language evaluation, which usually consists of several tests. They can do an articulation test, auditory discrimination test, language development test, vocabulary test, and they can also submit language samples. But all of that is compiled together to determine if a student is in need of any type of special education services. Now, the symptoms that we see, we kind of talked about before, is that they're going to have some syllable and sound repetition. There is going to be sometimes some prolongation, sometimes there's going to be some blocks, sometimes the words may be broken up, but those are the symptoms that you tend to see from people who have a stuttering disorder. Now, there is a high degree of heritability that we have found through research. There are some genes that they have isolated that they found to cause about 12% of the cases. So these 4 genes, they've seen that they are actually part of intracellular trafficking, and that is where the defect in this disorder is occurring. And so they're doing further research to try to see if they can figure out what's happening in these genes that's causing this disorder to occur. Because the more research they're able to find, they may be able to target those areas and reverse the stuttering earlier or even prevent it. But it is complex, it's multifactorial, and it is heterogeneous, meaning that it involves several components, and it's going to take more research to be able to target this area and try to find treatments or preventions for the stuttering disorder. As far as race is concerned, there's really no difference between the stuttering that's found in African Americans versus European American children. For both racial groups, what was found is that boys had a higher prevalence than girls, which is about that 4-to-1 ratio. So they looked at age, race, and sex, and only sex was really a predictor as to whether or not a child would experience stuttering. So what services do they receive? They typically receive these specialized services from a speech language pathologist that will either pull them out of class several times a week to meet individually or in small groups, or they may actually go into the classroom to offer services to the child. The other people that play a role in this is going to be your special education teacher, the general education teachers, and also school counselors will play a role in that because these students will need support in every area in school when they do have a stuttering disorder. Now, the exact cause is not really known for this particular disorder. And again, about 80% will outgrow the disorder. There are no drugs that are prescribed currently for the disorder. Just typically, the children will receive therapy. So your speech language pathologist will provide the therapy using cognitive and behavioral techniques. And then your school counselors may come in to help support them socially and emotionally and in the academic functioning that they have to attend to in school. So They use a comprehensive school counseling program to do so. They will speak with the students and make sure that they are socially and emotionally and academically okay and functioning in the school environment. So, some teaching strategies that can be used. One is an anti bullying curriculum because a lot of people with stuttering conditions will experience some type of bullying or teasing from their peers. And so, this curriculum, what it does in the classroom is it's going to promote positive attitudes towards students that have a stuttering disorder. There are 8 components that go into this. They want to explain to students what bullying is, why it upsets people, why a person may opt to bully someone, how it feels to be bullied, how you can help another student who is being bullied, how to resolve conflict, and then look at the classroom rules and consequences if bullying does occur. The final component is going to relate to the stuttering itself, allowing students to understand what causes stuttering, help them understand what stuttering is so they can recognize it, and then strategies that they can use to help their classmates who do have a stuttering disorder. Another thing you can do is facilitate verbal responding. A lot of times, students with stuttering disorders don't necessarily like to speak in class, or they have a preference as to when they speak in class. So, some may want to speak in small groups, some may want you to call on them earlier in the lesson or later in the lesson, or they may want you to wait for them to volunteer, or they may want to be called randomly, or they may want to say, hey, call on me second. If they have a preference, you want to make sure that you collaborate with the students so that you can support them as best you can with their condition. And the final one that we can do is we can adapt our materials. We can use technology that may help with the disability. One thing is Nearpod, and I've used this in my classroom. It allows students to type in their responses to your open-ended questions. So you can see their responses in real time. You can give them feedback. You can also share it with their peers if you need to, so that they can see the responses. And it does not necessarily require a student to speak out in class. And it relieves some of that anxiety they may have with speaking in front of their peers. All right, so this concludes my presentation on stuttering. Through the research, I have hope that they will find some solutions for earlier interventions so that students do not have to spend so much time in school trying to combat this disorder. Maybe they will further their research with the genetics behind it and come up with a solution for early intervention. Thank you.